Minister, you're very welcome into the House, and you know this is a very welcome bill, the Health Amendment Bill. It abolishes the daily rate of €80 for acute inpatient services up to a maximum of 10 nights, €800 in a 12-month period. In the Dáil, you stated it was a very clear symbol of our path towards universal healthcare. Do we have a clear path towards universal capacity? At the start of the month, Minister Ryan stated that there aren't any plans to make public transport free, as that would increase the number of unnecessary trips. Minister, do you have any similar fears about universalised healthcare? Of course, we welcome the following government decisions: the reduced prescription charges, the increased medical card access for those aged 70 and over, the reduced and maximum monthly amounts families pay for medicines in 2020 and last year from 114 down to €80. And we look forward to strides in specialist services in endometriosis, perinatal mental health and menopause. The big one is waiting lists. And what's the plan? The 2023 waiting list plan is funded. It's funding the HSE and the National Treatment Purchase Fund to reduce hospital waiting lists by 10% in 2023. Hospital waiting lists rose again in January due to the widespread cancellation of non-urgent appointments and procedures. In January, 589,670 patients were waiting to see a consultant. Overall, waiting lists fell about 4% last year, well below the target of 18%. The challenges facing the healthcare system, the access to care, the overcrowding, the waiting list, services not being available in holiday seasons like Christmas, it was just an absolute mess this year. So, and children's healthcare, particularly children with disabilities, children with scoliosis, the length they have to wait there is just scandalous. So speaking of waiting, Minister, could you give me an update now that you're here in the House on the COVID-19 inquiry? I'm aware that the Taoiseach Líoba Varadkar has said that the full public inquiry into the state handling of COVID-19 pandemic will not be done quickly and will take time, but that he is determined to have an inquiry up and running this year, ideally by the middle of the year. He has indicated the inquiry will examine how the pandemic was handled in Ireland, covering healthcare aspects, testing, public health advice and the economic and social response. Personally, I'd like for the media to be held account too, but we'll see how that goes. On Caftrio, Minister, I have to thank you for the work that you've done. It didn't come quickly enough, but it came. I got an email last week from Vertex, who I've been hounding as well as you, and I suppose really we just want to make sure that the children going forward, and I just want to read something from it, from that email. We have discussed with the HSE the path forward for other CF patients who could be eligible for our medicines in the future but fall outside the existing reimbursement agreement. So can we get back to the drawing board in relation to that, please, in a timely manner? This is another thing they've said. We recognise the Irish Government has put forward some proposals to improve pricing reimbursement processes following the recent publication of the Mazars report, and that the Department of Health is developing a new national rare disease plan. So if you could outline those proposals too. So Minister, you know, we all want it to work and we all want it to work well. And if we can help you in any way to speed up processes with various companies that you're trying to do, procurement is really, really important when it comes to these medicines, as you well know. And getting the deal right at the very, very beginning to make sure that it takes in cohorts that may have variations down the line. That's also equally important, that we lock them in at that price at that very time. So, Minister, thank you for the work you've done. But the bottom line is this, in this particular thing with Caftrio, is the price per head, the agreement reached with the pharma companies to access all of their drugs for anyone who needs them. We can't go through this whole debacle again for the children of cystic fibrosis. But thank you.
Thank you, Senator.